Hello guys, so this is the second lecture of pharmacology, and in the previous lecture we discussed about pharmacology, the basic concept, what it means, the definition of drug, and what terms does it include. Now we will discuss the most important terms that are included in pharmacology, that are pharmacodynamics and pharmacokinetics. These are basically the two main divisions of pharmacology. And now starting with the pharmacodynamics, what basically pharmacodynamics means. So this is also a branch of pharmacology. We can say it's a branch of pharmacology. It deals with the study of biochemical and physiological. I will write in short terms so that more of the time is saved. Study of biochemical and physiological effects of the drugs. We'll write the definition first, then we will discuss it. And the most important thing, and their mechanism of action. And their mechanism of action. Now we see this pharmacodynamics, it is the study of biochemical and physiological effects of the drugs and their mechanism of action. So if we go deeper into this concept, what basically it means that what the drug does to the body. So if you are consuming any drug, what is the effect of the drug with the body, to the body, what it does to the body. If you're taking any kind of drug, it can be any kind of drug, we can quote thousands of examples for it. So what the drug does to the body, we studied it at every level. Like, we study it at organ level, we study it at tissue level, we study it at subcellular level, micromolecular level. So all these things are included in it. So now what it includes two terms, that is biochemical and physiological effects of the drugs. Now we will quote an example for it. We will take a very simple example, as I already yesterday took the example of PCM for better understanding, that is paracetamol. So we need to see what is the physiological and biochemical effect of the this very drug. So we can see by that, what I mean is, what is the mechanism of action of the drug, what it really does to the body, where it acts, on what level does it act, on what receptor does it act. So there are these things that we need to take into consideration. So for this paracetamol, it's we know it's for your information, it's para-aminophenol derivative. Para-aminophenol derivative. We know it's an NSAID, that is non-steroidal anti-inflammatory drug, and we know it has two main functions. Number one is it is analgesic, and number second is it is antipyretic. We will discuss these drugs later on in detail. Right now, we'll give the concept only. Now, we need to see how it shows the analgesic effect in our body and how it shows antipyretic effect in our body. Okay, antipyretic is decrease in the temperature, or we can say fever, and analgesic is anti-pain. Okay, now there are so many, like we can say, these mechanism of actions that have been different mechanism of actions have been provided by different researchers. There are so many these mechanisms, but the most important is that paracetamol, it's believed to produce analgesia. It's believed to produce analgesia through a central inhibition of, I will write in very simple words, inhibition of PG synthesis. PG synthesis. PG is prostaglandin synthesis. So we need not go into the detail what prostaglandin is. I'm just quoting an example here. So the analgesic effect of paracetamol is due to the inhibition of prostaglandin synthesis. And later on we will discuss what this is, what that is, what it includes, how it does it at the cellular level, macromolecular level, or organ level, how it acts. That will be discussed later on. So right now, what I need to clear is that how it shows a proper biochemical and physiological effect. It's because we see the mechanism of action behind these two effects, both these two effects, analgesic and antipyretic effect, is that there is the inhibition of prostaglandin synthesis. That means this prostaglandin synthesis, if this is increased in our body, what will happen? There will be fever and there might be pain. So this is the inhibition of PG synthesis is thus responsible for the action of paracetamol. Okay, so this is pharmacodynamics. So what the drug does to the body, and we know it includes all the physiological and biochemical effects of drugs at every single level, as I said, whether it can be organ system level, it can be at subcellular level, subcellular. Let me write here. If somebody wants to make a note, this will be helpful. Subcellular level is there. Yes, there is micromolecular level, macromolecular level, and extra macromolecular level and extra. Now, so this is pharmacodynamics. Now we will start pharmacokinetics. What basically pharmacokinetics is. So as we saw here in the definition, what the drug does to the body. So this is quite opposite. So we'll write here what the body does to the drug. What the body does to the drug. Now we can see this pharmacokinetics is simply the what the body does to the drug, what response does the body show to the particular drug. So this refers to the movement of drug in and the alteration of the drug by the body, which includes number one, what we read is K A D M E, cadmi. So what cadmi basically means? It's we K stands for kinetics, A stands for absorption of drug. Where does the drug absorb in the body? How the body absorbs the drug. Okay, and we see there is D, which stands for distribution, how the drug is distributed by the body, in what tissues, and M stands for metabolism, like where does the drug get metabolized. We know liver is the major site, we will discuss that later on. And E is the elimination, how the body gets rid of these drugs, how they are eliminated after their successful action. So this is pharmacokinetics. And we will later on discuss what it includes. It includes so many things, like I already said, it includes these four things. That is KADME, cadmi, that is absorption. And number second is D, I'm writing here, pharmacokinetics. It includes four things: ADME, that is absorption, and D stands for distribution, M stands for metabolism, and E stands for excretion. And we will discuss that later on, what these terms really mean. Now, there is another term that we need to just have the concept of, that is pharmacotherapeutics. Therapeutics. So, not go into the detail, very simple. So, it's simply what we do here. We it is the application of simply the pharmacological information together with the knowledge of the disease for its prevention. So let me write it here. It's the application of pharmacological information together with together with the knowledge of disease, that is pathophysiology or pathology, knowledge of disease for its prevention, mitigation, or cure. So what we basically do here, we select the most appropriate drug. For example, we what we do, for example, if we have a case like we have cancer, a certain cancer, for example, we have colon cancer. So what we do here, we study the disease first. We study the disease first very carefully. We study the disease. We study all the research, all the everything that's related to the disease. Then what we do, we select an appropriate drug. We select an appropriate drug. We select appropriate drug. Okay, and what we need to do here, we need to check the drug we are selecting. We need to know the dosage. We need to calculate the right dosage, like the duration. What should be the duration of the disease? Duration of the treatment. We need to see, and that we can that is based on the stage of the disease, stage, or we can say severity of the disease, severity of disease. And we also need to include the patient status, patient status. Like we need to include everything, every minute possible feature of the patient, like the age, the genetics, everything we keep into consideration. Then we select an appropriate drug. We select the right dosage. We select the right duration, and then for we know for reason being for the for the beneficial of the for the beneficial of the patient, for its prevention of any disease that he is suffering from. Okay, so this is pharmacotherapeutics. Now there is another term that is clinical pharmacology. I already have yesterday. I gave you the concept. It's nothing. It's pharmacology, clinical pharmacology. It's nothing but what we do here. We study the pharmacology in humans. We study the pharmacology in humans. Okay, so this is clinical pharmacology. But later you can find the definitions of this clinical pharmacology in various books. But I think this is the most appropriate. It's pharmacology that we study only in humans. Okay, and there are other terms, like another branch of pharmacology is there, that is toxicology. Very important. It's a separate branch, toxicology. As we see, toxic term. We know logy means to learn, to study. So what we study here, the poisonous effect of drugs or other chemicals, not just the drugs. It includes all the chemicals, like we have the agricultural drugs, agricultural these chemicals that we use, or the industrial wastes, or the industrial chemicals, or the household chemicals, or the environmental these pollutants. We study the poisonous effect of these chemicals or these drugs. And what is the basic aim of this toxicology? We emphasize on the detection. Number second, this is the first step. Number second is the prevention. Number third is the treatment. There is a concept that I want to let you guys know, that is every drug, every drug, every drug. If we if we increase the dosage from the dose of a particular drug, it turns it in one way or the another way. It turns into a poison, or we can say if overdosed, any kind of drug, if overdosed, it eventually affects the health, that it turns into poison. So these things also come under the heading of toxicology. That's why we need this is the main branch. This is one of the most important branch of toxicology. So I guess this is a very short the definitions that I have told you. It will not require any rocket science to understand. This is very basic, and in next very chapter we will study the sources of drugs, what they include, and we will just go through the drug nomenclature a little bit, what names it includes. Like we have, as I'll give you what does a chemical name mean, or what is a brand name, or what is like generic name. There's non-proprietary names, or we can say there are so many these things that we need to consider. Number three is brand name, is non-proprietary name is there, as these terms are very much famous. Like this medicine is generic and this drug is branded. So we need to we will hopefully do it tomorrow, non-proprietary names. And then we will look for these books that are related to these drugs, like the official books that are related, official books, like we have pharmacopoeias, we have pharmacopoeias, we have pharmacopoeias, we have these formularies, we have so many things in pharmacopoeias. We have Indian pharmacopoeia, as you must have seen in any manufactured drug. If you have a strip of paracetamol, you will see uh, ingredients, or we can say composition. Backside of the strip, you can see there is paracetamol 500 mg IP or BP or USP. So these terms we will discuss tomorrow. This is Indian Pharmacopoeia, this is British Pharmacopoeia, and this is United States Pharmacopoeia. So these are the official books which provide us the information, every single detail, how the drug is made, the description, the chemical structure, the molecular weight, the physical chemical characteristics. So this is very basic, and we will do it tomorrow. Don't forget to subscribe. Thank you.